Welcome to Medicine Official. Let's revise anatomy. All right, question 1 says, which of the following bones is the bone of the forearm? So it's a humerus. We'll be very fast. Question 2 says, which of the following cells is responsible for apposition or growth of hyaline cartilage during growth and development? So the answer is chondroblasts in the perichondrium. This is the answer here. Question 3. The foramen magnum is located in the occipital bone. It is found in the occipital bone. Question 4. Which of the following types of collagen is the principal protein forming the intricate three-dimensional meshwork found in hyaline cartilage throughout the body? So it is hyaline cartilage has got type 2 collagen. So the answer is C here. Which of the following statements about ribs is false? All ribs are attached to the sternum anteriorly. This is a lie. Their floating ribs are not attached to the sternum anteriorly. Question 6. A 57-year-old woman undergoes spine fusion surgery. Following the procedure, the surgeon prescribes osteogenic protein 1 to promote bone growth and healing. Osteogenic protein 1, also referred as bone morphogenic protein 7, has shown to stimulate the differentiation of mesenchymal cells to yield which of the following cell types? So the answer here is D. The answer here is A rather, osteoblasts. Because you know that the osteoblasts are the ones that will produce the bone. Question 7. An 18-year-old woman complains of fever and severe diarrhea for 3 days. Her temperature is 38 degrees Celsius. The CBC, complete blood count, reveals an increased hematocrit, most likely caused by dehydration and hemoconcentration, secondary to diarrhea. Which of the following represents a normal hematocrit reading for this patient? So it is 40% because this is a woman. Okay, the hematocrit is in the range of 40s. Question 8. Which of the following couple bones is found in the distal row? So the proximal row is like this. She looks too pretty. Try to catch her. So the one that is found in the distal row is the capitate, the C here. Question 9. Which of the following statements about the spinal column is false? So the answer here is the first cervical vertebrae is called the axis. No, the first one is called the atlas, not the axis. The second one is the axis. Question 10. Which of the following organs lack lymphatic vessels systems? The lymphatic systems. So the answer is the bone marrow. The bone marrow doesn't have the lymphatic systems. All right. Dash are the vessels that function as reservoirs to ensure blood flow while the ventricles are relaxed. So it's a venous. So these are vessels that function as reservoirs to ensure blood flow while the ventricles are relaxed. Question 7. Dash is the process by which white blood cells leave blood capillaries to enter the tissues. So it's called diapedesis. Diapedesis. Which of the following parts of a neuron occupies the gray matter in the spinal cord? Which of the following parts of the neuron occupies the gray matter in the spinal cord? So the answer here is the motor neuron cell bodies. 14. Destruction of the ventral horn cells of the spinal cord results in loss of motor control. Because you know that the ventral horn, that's where the motor control, the motor horn is. 15. A 16-year-old on the high school athletic team, swim team, is concerned about the effects of water on her skin. She asks you whether she should apply creams or lotions to waterproof her skin before entering the pool. You explain to her that the skin itself serves an effective water barrier to protect the body. Which of the following components of the skin is most important in establishing an effective water barrier? So it is the cell and lipid envelopes. Cell and lipid envelopes. 16. You watch a group of high school students playing football. Which of the following components of the circulatory system plays the most important role in directing increased blood flow to capillaries in the skeletal muscles of these young athletes? So the answer here is the arterioles. Which of the following is not a type of capillary? So it's elastic. You have continuous capillaries, fenestrated and sinusoidal, but you don't have elastic capillaries. Vasa vasorum are found in the tunica dash of a large blood vessel. So they are found in the externa. Vasa vasorum are found in the tunica externa. So the tunica externa here is simply the outermost layer. Okay. The tunica adventitia. It's also called the tunica adventitia. Number 19. A small space within compact bone housing an osteocyte is known as a lacuna. 20. The pericardial cavity is located between the parietal and visceral layers of the serous pericardium. Excellent. A. 21. A 15-year-old girl complains of uneven shoulders that she first noticed 3 months ago while trying on a new dress. Physical examination reveals uneven back musculature, and a prominent left scapula caused by rotation of the thoracic ribcage. Radiologic studies confirm mild scoliosis. This developmental abnormality is most likely caused by asymmetric growth of which of the following musculoskeletal structures? So it is because of the cartilage growth plates. The cartilage growth plates, if they are not aligned in the disc, in the vertebral column, you have scoliosis, which is simply bending of your spine. 22. Which of the following blood conditions is also known as erythrocytosis? So it is polycythemia. Polycythemia is also known as erythrocytosis. Continuous capillaries are present in the lungs. Continuous capillaries are present in the lungs. The parents of a 3-year-old boy complain that their child has a high fever, sore throat, and hoarse voice. On physical examination, the child's epiglottis appears swollen and erythematous. The boy is diagnosed with acute bacterial epiglottitis. In considering this case, you recall that the epiglottis at the entrance of the larynx is composed primarily of which of the following types of connective tissue? So it is elastic cartilage. You know, the epiglottis has got elastic cartilage. Which of the following bones are found in the foot? So in the foot you find the tarsals. In the hand you find the carpals, but in the foot you find the tarsals. 26. Muscle impulses are spread rapidly between cardiac muscles by intercalated discs. So the intercalated discs have got gap junctions which will transfer these muscle impulses, the electrical impulses. A 16-year-old girl is seen for her annual health checkup. Measurements taken in the office indicate that the patient has grown 15 centimeters over the past year. Which of the following cells in the epiphyseal growth plates was chiefly responsible for the longitudinal growth of long bones in this patient? So it's chondrocytes in the proliferation zone of the growth plate. which is not a function of the paranasal sinuses. So it's gaseous exchange. They are not involved in gaseous exchange, but they humidify inhaled air. They are responsible for sound resonance and for warm inhaled air. The following, all right. So the rough muscles in the right atrium are known as the musculi pectinate, the pectinate muscles. The rough muscles in the right atrium are known as pectinate muscles. 30. Which bones form the hard palate? So the hard palate are formed by the palatine bones and the maxilla. 31. The immature cells that produce osteoid are known as osteoblasts. 32. Which of the following cartilages can ossify to become bone? Which of the following cartilages can ossify to become bone? It's costal cartilage. Costal cartilage can ossify to become bone. Which of the following bones is the longest bone in the human being? So it's the femur, which is the bone of the thigh. 34. A 15-year-old girl presents with severe acne. Physical examination reveals many discrete papules and pustules on her face and neck. Acne is a chronic inflammatory disorder that principally affects which of the following subcutaneous structures? So it affects the sebaceous glands. Acne affects the sebaceous glands. 35. A person with blood group A has anti-B antibodies in their blood plasma. 36. All of the following vessels branch directly into the aorta except the right common carotid artery. Except the right common carotid artery. A 28-year-old white woman returns home following a 4-week summer vacation at the beach. Her friends and family comment that her skin has become much darker in color. Which of the following biological processes accounts for this change in skin coloration? It is an increased production in melanin. 38. In fetal life, blood from the pulmonary trunk is shunted to the arc of the aorta through the ductus arteriosus. 39. During a third year clinical rotation, you are asked to discuss the biological functions of the skin. Thermoregulation is the primary function of which of the following epidermal appendages? So it is the eccrine sweat glands. The eccrine sweat glands. 40. In addition to providing body insulation and maintaining energy homeostasis, adipose tissue is considered to be an important organ for which of the following biological functions? It is A. Endocrine secretion. Endocrine secretion. 41. So we are halfway in the question paper. During a dermatopathology conference, you are asked about differences between thick and thin skin. Which of the following epidermal layers is a unique feature of thick skin? So thick skin has got a stratum lucidum. Remember, thick skin has got 5 layers, while thin skin has got 4 layers. So the additional layer in thick skin is the stratum lucidum. 42. Which of the following bones is a long bone? Which of the following bone is a long bone? It is the sternum. 43. Okay, 42. This is a flat bone rather. So the long bone here is the phalanges. So this is the answer, the phalanges. This is a flat bone. All right. 43. The dash veins are the only veins that carry oxygenated blood after birth. So it's a pulmonary vein. 44. Which of the following statements is false regarding red blood cells? Let's see. Sickle-celled erythrocytes lack hemoglobin. No, they do have hemoglobin. They're just sickled. 45. The parents of a 3-year-old boy are concerned that their son shows signs of physical and mental retardation. After a series of physical and laboratory examination, the child is diagnosed with Howler syndrome. This rare disease is caused by disordered degradation and abnormal accumulation of which of the following connective tissue structure components? Select one. So it is proteoglycan coproteins. 46. Most dash vertebrae have a long spinous process that is angled inferiorly. So the answer here is the thoracic. Have got long spinous process that are angled inferiorly. Which of the following cells is not a granulocyte? It is the monocyte here. The dash cartilage of the larynx forms the laryngeal prominence. It is the thyroid cartilage of the larynx. Okay, 49. The clavicles articulate with a dash at the sternum. The clavicles articulate with a dash, so with the manubrium. 50. You attend a lecture on the physiology of lactation and breastfeeding. Under the influence of pregnancy-associated hormones, epithelial cells of the mammary gland secrete lipids, carbohydrates, and proteins. The lipid components of breast milk are released from the apical surface of the glandular epithelial cells as lipid droplets within an envelope of plasma membrane. Which of the following terms best describes this mechanism of secretion? So it is called apocrine secretion. Breast milk, mammary glands secrete by apocrine secretion. Which of the following bones of the skull is unpaired? It's a sphenoid. So everything else is paired, but the sphenoid is unpaired. A 59-year-old obese woman complains of sharp pain and stiffness in her knee joints. The pain is typically worse following exercise and prolonged use of her joints. She is diagnosed with degenerative osteoarthritis. Which of the following best describes the pathogenesis of joint pain in this condition? So it is degeneration of articular cartilage. Degeneration of articular cartilage. Acute inflammation of the joints is in rheumatoid arthritis. Okay, so the formed elements of blood include the following, except the plasma is not a formed element. It is a liquid part of blood. 54. A large lav projection of the bone is known as a tuberosity. 55. Which of the following types of cartilage or bone is found in the epiphyseal growth plates of children and adolescents? It is hyaline cartilage. Which of the following statements is false about coronary arteries? So they get filled during systole of the blood. No, it's the opposite during diastole. 57. Which of the following statements about ribs is true? Floating ribs are false ribs. True. They're called false ribs. Okay, 58. Which statement about veins is true? Their tunica externa is thicker than in the arteries. True. 59. Which structure is the smallest portion of the conducting portion of the respiratory system? So the answer here is the terminal bronchi. Which structure is the smallest portion of the conducting portion of the respiratory system? conducting portion, terminal bronchi. Okay, 60. A 2-year-old girl with itchy skin and respiratory distress is brought to the emergency room by her parents 30 minutes after eating peanut butter cookies. On physical examination, the patient shows flushing and swelling of her lips and eyelids. Hives are present all over her face and arms. Vital signs are blood pressure 40 over 50 millimeters of mercury and pulse 100 per minute. Which of the following inflammatory cells is primarily responsible for the development of increased vascular permeability in this patient with a severe peanut allergy? Select one. So the answer here is eosinophils. So the eosinophils are the ones that are responsible for for allergic reactions, together with the basophils. So 61. During clinical rounds, the attending physician asks you to discuss basic principles of hematology. Which of the following is the most abundant formed element in the blood? It is the erythrocytes. The red blood cells are the most abundant formed elements. 62. Which of the following statements best describes arteries? They all carry deoxygenated blood. They all carry blood from the heart. True. C. 63. Which of the following is a flat bone? It's a sternum. 64. A 14-year-old girl fractures her right fibula playing soccer. The leg is immobilized in a cast. During healing, a soft callus forms at the site of bone fracture. Which of the following represents the primary tissue composition of the patient's soft callus? So it is just cartilage and dense connective tissue. So the answer here is E. 65. Which of the following cells increases in number during viral infections? Lymphocytes will increase. So initially, if you get HIV, the lymphocytes are going to increase. Which statement is false about the trachea? It is C. It is lined with a non-keratinized stratified squamous. No, it is pseudostratified ciliated columnar epithelia. 67. Which of the following statements is false regarding blood vessels? Coronary arteries have got valves. Absolutely not. So this is false. 68. Type 1 collagen belongs to which subfamily of collagens? So here the answer is the ankyrin fibril forming collagens. 69. A 58-year-old man with a history of ischemic heart disease is scheduled for coronary artery bypass graft surgery. Before cutting the costal cartilages to open the chest cavity, the surgeon is mindful that healing of the cartilage is problematic. She understands that hyaline cartilage has a limited capacity to undergo repair and regeneration due to which of the following intrinsic attributes? So it's avascularity. Hyaline cartilage doesn't have blood supply, so it's avascular, and because it's avascular, it will have a hard time healing. 78. A 78-year-old man with prostate cancer and bone metastasis presents with shaking, chills, and fever. The peripheral white blood cell count is 1,000. Normal range is 4,000 to 11,000. Which of the following terms describes this hematological finding? So it is leukopenia, because the white blood cells are low, so that is leukopenia. Which of the following osteocyte-derived biomolecules is the major structural component present in the bone matrix? So it is collagen type 1 that is found in bone. 72. The thickest part of the heart wall is the myocardium. The myocardium. The pelvic bone is made up of the following bones, except, so you don't have the The sacrum. The sacrum is not the pelvic bone. 74. A 28-year-old man with achondroplasia is admitted to the hospital for hip replacement due to severe osteoarthritis. He has short arms and legs and a relatively large head. Which of the following pathogenetic mechanisms is most likely responsible for the patient's inherited condition? So the answer here is arrest of the epiphyseal growth plate, because that's why he is short like that. 75. Which of the following bonds forms via the intramembranous ossification pathway during embryonic and fetal development? So the answer here is the mandible. Intramembranous ossification. It is the mandible. 76. A herniated intervertebral disc was removed surgically from the lumbar region of a 48-year-old man. Which of the following types of connective tissue is located within the peripheral annulus of this patient? Patient's intervertebral disc. So it is fibrocartilage. Fibrocartilage is found in the peripheral annulus. Which structures on the bones is used by nerves and blood vessels to access the bony matrix? So it is the foramen. The foramen, there's a bone foramen. 78. Which of the following is the correct circulatory sequence for blood to pass through part of the heart? So it is the right atrium, right valve, ventricle, pulmonary, semilunar valve. Yes. 79. This is the second last question. In anatomical position, which of the following bones is positioned laterally in the forearm? Select one. So it is the radius is lateral, the ulna is medial. This is the last question. The compression of an infant's skull bones at birth is facilitated by spaces between unfused cranial bones that are called fontanelles. All right. So this was the anatomy revision. It was very basic, just to allow you to test your knowledge. Okay. All the best.